Hi everyone, my name is Maya Parker. Today's date is 3/29/2025, and I am here taking this biochemistry course at University of New England online with all of you. This is my introductory video, talk a little bit about me, and begin with I live in Western Massachusetts. Um, Massachusetts is a very small state, but I am west of Worcester, and I am in the greater Springfield area. I live near Northampton, which is a beautiful small college town. I live just west of there, and we live very rural. We love it. There are animals, trees, trails, nature. I mean, it's kind of paradise as far as that's concerned. My hobbies include being outside. Now that the weather's getting nicer, my hobbies include biking a lot. I do road bike or gravel biking, which is sort of a hybrid between um, road biking and like cross-country mountain biking, I guess. Um, I like being outside. I like doing yard work. I have a fairly large piece of property here that we have done a lot of work to in the past 6 years. Um, it was basically just a house in the middle of a forest that came right up to the house, to the back porch, and we had to really clear that and make room for to have like a nice yard. So that's a constant work in progress and something I look forward to every spring and summer and fall, anytime it's not winter. I do have a family. I am married and I have two teenage children. I have a 17-year-old and a 15-year-old, and they live here and they go to school. And I'm constantly trying to inspire them to, you know, what they want to do when they are older. So far, neither of them really want to do what I'm doing, nursing, even though I do encourage them still. My occupation is I am a registered nurse. I work in Springfield, Massachusetts. I work at Bay State Medical Center. It's a level one trauma center. It's the only one around here. And I work in the surgical trauma ICU. So any high acuity complex surgical procedure where people perhaps are not recovering very quickly, or they need blood pressure support, or they need ventilatory support, like breathing support, just a myriad of things. And then any traumatic injury. So anything you can imagine that would cause somebody to have severe traumatic injury and need that extra support from us. So we get to see a lot of really interesting things. It's a really hard job, but um, it's it's a very interesting job nonetheless. Um, I am not a full-time student. I work full-time, and so I am only taking one class at a time. That's about all I can handle. Um, my reasons for taking this course are to be accepted and to nurse anesthesia school. This is really important to me to um, better myself, my education, provide a better quality of life for myself and my children. Basically, I want to pay for my children to be able to go to college, and I feel like I really need to elevate my own career and before I am able to comfortably do that. My favorite food would have to be, there's a few different things. Luckily, in this area, we have so many family farms, and the benefit of that is we have a lot of local meat, a lot of local produce when the weather is appropriate, and a lot of local dairy. So and of course maple syrup. And it just finished, maple syrup season just finished, so we get a lot of that. But I would say my favorite foods are local steak that we get from a couple places around here, and some people make some like local kimchi, which is like really great, and local yogurt. There's a farm near me that makes the Icelandic like strained yogurt, skyr, I think it's called. Um, and they make it with either plain or local maple. And I like the local maple, the maple flavor. That's kind of been my go-to snack lately. And I think that pretty much wraps up the introductory video. I'm trying to think if there's anything else I should talk about, but I'm just happy to be here, and I'm actually looking forward to biochemistry. This really applies to what we do in critical care. We are constantly trying to maintain homeostasis in our patients, and that includes paying very close attention to their acid-base balance. We do that through arterial blood gas monitoring. We do that through, that's mainly, but we do that also through just respiratory carbon dioxide monitoring too. That's more of a continuous measure. So we do that. We obviously in our trauma patients and a lot of our surgical patients, we have to address the, coagulation issues. People sometimes get massive blood transfusions, and this can introduce a lot of a calcium binder in their blood, which can make them hypocalcemic, which affects the clotting cascade and so on and so forth. But ultimately, my job has a lot to do with the biochemistry of our bodies, and that we just are really trying to maintain homeostasis in these really extreme conditions. So, all right, I'm looking forward to this class, and I will looking forward to seeing other people's introductory videos. All right, bye.